it's very important after such a big conference with so much data to try to sublimate, all these results and try to understand how how those results are actually important for us as a CRO and how we can help our existing clients and our future clients that are doing research in hematologic malignancies. And I do believe that I will go back to the very important fact of writing the right protocol. And we saw a lot of step up, like looking at minimizing toxicities, minimizing CRS in the bispecific antibody field, which is quite vast right now. There are a lot of options across a variety of hematologic malignancies, and making sure that we implement the step up practices to minimize CRS and ICANS. I think it's one of the important directions to take, as well as limited duration. So the field is moving from, unlimited use to 12 months, 12 cycles of limited duration in order to minimize toxicities. But also it's thinking about the patient. These are the results of real life data where treating patients for longer period of times, it decreases the quality of life in those patients. So making sure that we find the balance between a limited duration of treatment and efficacy. Moving forward in writing these protocols, I think analyzing the data that is already existent and making sure that we take into consideration all these aspects, we certainly can help guide and create very good protocols, efficient protocols that will maximize the treatment effect, but also minimize the potential toxicities. And I think this is very important. Thinking about accessibility as well, how do we make these treatments accessible to a wider range of patients? And also thinking about globalization, going in different geographic areas is important. And right now, they tend to be global studies. The research is going from, one country-based type of research to more geographic regions with a very important purpose. You have a more varied genetic background, and you can basically accumulate data that in one study, and you don't need to do another study in a different geographic region. So again, these are several takeouts that could guide the way we advise our clients and help them write the protocols.